the patient, I just led the patient on. So now what I'm going to do is I'm actually going to stay with the patient for the first 3 to 5 minutes of treatment. So first thing I'm going to do is I'm going to go ahead and take a blood pressure, and I am going to start optimizing that blood pump, easing him up to the optimized blood flow. He's ordered 400 or optimized. It looks like he's been running 300 for the last 3 treatments. I'm also going to make sure that the access is visible. During this time, I know that 3 to 5 minutes seems like a long time to stay with your patient, but you can also do some safety things, like you can do one more final type test, make sure that those lines are secure so that we don't have those coming apart. You can go ahead and secure your lines with some tape onto the chair. We're going to pump you up a little bit more there. Feeling okay? Mm-hmm. Okay, your blood pressure is all right. We can, during this time, do an environmental scan, mitigate any safety issues like tripping hazards. We can be sure that the patient's chair is all the way to its lowest level. Again, brakes are on. We can make sure that they have their call bell, which I think is behind you. We'll grab that in a second. We can also ask the patient for ice or blankets, and you already said no to ice. Did you want any blankets?
One blanket.
One blanket, okay. Also lighting preference, lights on or off. Okay. Okay, so it looks like your pump speed's at 300. The pressures, the line pressures look appropriate. That's great. Just gonna widen those parameter boxes a little bit. I'm also going to have time to come over and do my vascular access charting. Okay, so again, before I leave the patient, I'm going to make sure that I chart with my access note. Remember, we want to document as close as we can to in real time. So this is a great time to go ahead. We're going to go to the access section. Going to click new, okay? If there was any swelling or drainage, I would go ahead and use the drop down. There was no swelling or drainage. If something was unsatisfactory about my access assessment, I would go ahead and tick that unsatisfactory box. That will then highlight my note in the history of notes as red and draw attention to it. However, his assessment was satisfactory. So you're going to go ahead and be sure to tick off any appropriate boxes on your assessment. And you can also go ahead and you can make any comments if necessary. Please note that I have done my initial access note. If anything were to change in the course of this treatment, please note that access notes are not one and done. So if something happens, I need to change the patient's from straight to reverse, reverse to straight, we have some CVC dysfunction, I would go ahead and make sure that I make a new access note. Now the patient's on, I'm also going to be sure to go back to orders, to go to test requisition. Like I mentioned earlier, I noted that he was due for an INR. I'm going to click that, press details, and I'm going to be sure to complete this order, okay? Perfect. I've also decided to go ahead and use the patient's anticoagulation today, so I have administered that, and I am going to now document that. So he was due for dalteparin, 2,500 units. I'm going to go ahead and press details. I'm going to press admin, and I'm going to be sure to document that that medication was given. So just to review here before I step away, I have made sure that I've charted as per unit policy by exception, but also making some mention of his dizziness and cramping. However, it's not new or worsening and doesn't deviate from his baseline. And I just made a small comment about how I am planning to remove the full total UF goal today of 1.9 liters. once I've charted in the patient assessment box, I'm just going to go back one more time to our objective tick boxes in the assess section, just to be sure that everything is appropriate is checked. I've checked that I have checked the chart, and I have on bedside. As you can see, quite comprehensively, we can do almost all of our chart check on bedside. I am also going to take time to seek out if one of my fellow coworkers is available to have them do the double check of my chart and to make sure that I've done everything appropriately, and they would sign that off as the double check.